Okay, welcome everyone. I'm Dr. Ali. I'm a pelvic floor physical therapist and co-founder at Tonic and Phasic Pelvic Health. You are joining this webinar on perineal massage for birth preparation. Today, we will be discussing key concepts, techniques, and evidence supporting perineal massage during pregnancy. And today's agenda, we will be discussing pelvic anatomy, what is the perineum and why it matters, benefits and considerations of a perineal massage, techniques and positions of a perineal massage, and if you do tear, what are the healing expectations? And then we'll close it. I will stop the recording and then we'll do question and answer. All right, so let's get started with some pelvic floor 101. So if I am seated here, right? So I will have you do this at home. I have my two waist bones right here. The waist bones come meet at the middle at the pubic symphysis. These two bones right here are our sit bones. So when we wiggle back and forth, this is what we should be sitting on. And then we have right here our hip sockets where our legs are coming out of. And then we flip it to the back. This is the L4, L5 vertebra. And then we have the sacrum, and then the sacrum narrows down into the tailbone. And then right here is our SI joint, our primary stability joint. And so why I point out all of the bones is because all of the red, the pelvic floor muscles, attach onto the pelvis, and they can determine our pelvic positioning. So we have all of the red, which are the pelvic floor muscles. These muscles right here are more superficial in nature. So if you were to take your hand and just palpate your vulvar tissue, you're going to be touching this tissue right here. And that tissue's main purpose is for penetrative function or birthing function. So this tissue has to elongate to allow for successful penetration or for childbirth. Now we have the internal part of the pelvic floor. So we have our bladder that sits right behind the pubic bone, like so. And then we have the uterus that takes a bow over the bladder. And then we have the rectum that sits right behind the vagina and right behind the uterus. Now, if I were to remove all those organs, again, we're looking at the deep pelvic floor muscles. These are the internal muscles. So if we look at these muscles right here that are right behind the pubic bone, they come in and they slingshot around, anchoring onto the tailbone, and then we'll go to the next side. Now, these two muscles right here, their main function is sphincteric, meaning they are in charge of bowel and bladder control. When you hear the word Kegel, we are talking about specifically those two muscles. Then we have these muscles back here, and their main function is support and stability of the pelvic organs. And then they work with our core muscles that are attaching to the top of the pelvis to help keep us upright, biomechanics, walking and running. Now we have the perineum. The perineum is right here. So this is the key muscle that we will be talking about today. So this muscle is a central point of the pelvic floor. And so we can see that it is very microfibrous. It's a dense tissue. And it's actually coming up and it's connecting with this labial muscle. So this muscle's right behind the labia. It comes in onto the pubic bone. It comes around, makes this figure eight, goes to the next side, wraps around the external anal sphincter, and then it wraps around, anchoring onto the tailbone, wraps back around, comes back into the middle, and then back to the other side. And so we can see that the perineum is super important when it comes to connection with the pelvic floor. And now why it matters for childbirth is that this tissue needs to be able to lengthen. And if we aren't able to lengthen it, then that's where tearing can happen. And so our goal with a perineal massage is to reduce the risk of a third and fourth degree tear. And I really want to explain what that means when we talk about tearing. So we have back the pelvic model. So during childbirth, this tissue can tear if it is not well mobilized. So a first-degree tear will look like just a tear in the vaginal mucosa and just right at the tip of the perineum. A second-degree tear comes all the way down past and then now into the perineal tissue, into the perineal body. A third-degree tear is whenever the tissue or whenever the tear now extends past the perineal body and into the tip of the external anal sphincter. And a fourth-degree tear is whenever it extends vaginal mucosa past the perineal body into the external anal sphincter and into the rectal mucosa. Now, a third and fourth degree tear are pretty serious and they definitely require sutures and sometimes surgical repair. And again, our goal is to reduce the risk of that third and fourth degree tear. With first degree tear, people may not even need stitches, a second degree tear. Most people will need sutures or stitches. And then, like I said, a third and fourth degree tear may need surgical repair. And that is something that we want to avoid because that third and that fourth degree tear can affect bowel and bladder function, sexual function, and even support and stability because this muscle is anchored to the rest of the pelvic floor. So when performing a perineal massage, again, goal is to reduce that third and fourth degree tear. And by massaging, we know that there is an 85% less likely chance of having that third and fourth degree tear during childbirth. And this is even more specific for women who are giving birth for the first time. So I like the analogy, so I will always use one when comparing. So if I were to ask you right now, get into the splits. I don't know about you, but for me, I would say I'm not gonna be able to get in the splits. And if I try, I may tear something and I may injure myself, and those chances are very likely. However, if I were to give you 2 months or 3 months to practice to get into those positions, I would have an easier chance of having less tearing and less injury. And so that is the goal, is to be able to give you time to prep that tissue. Now let's talk about the benefits and considerations of a perineal massage. I'm such a fan of informed education. If you do choose to do a perineal massage, I want you to know why you're doing it and you have options where you're like, maybe this isn't a right fit for me. I want you to know everything. So the benefits is that you're going to have a less chance of, again, that third and fourth degree tear. You're going to have a reduction of postpartum pelvic pain at that tissue because we've been working on desensitizing it already months until you've given birth. The third is that we improve elasticity and tissue awareness. And then lastly, I think this is by far one of the best ones, is that it builds self-confidence and self-connection. So I read this really interesting research article on perineal massage, and it was talking about all the pros and considerations. And one of the biggest benefits was providing that connection with your body. So women who do perform perineal massage weeks before they give birth are actually going to have a reduction of tearing because they know how that tissue should move. And they've already been used to advocating for themselves, communicating with their partner, and they're more likely to communicate that with their staff who is helping deliver the baby, which I think is a really beautiful benefit. Now, something to consider when performing a perineal massage. If you are not used to having internal touch to that area, at first it can be uncomfortable. And so what I like to say is whenever you are introducing a perineal massage, we have a scale of 1 to 10. 10 being extremely painful, 1 very mild discomfort. And so what I want people to stay is in between this 1 and 4 discomfort scale. If you start off and it's a 5 and it stays at a 5, we definitely want to seek care from a pelvic floor PT, OB-GYN, or your midwife. And so the goal is that it is going to be uncomfortable, and that's the point, is that we want to stretch that tissue. And so the point really of a perineal massage is to create micro tears into the tissue. And so I think about if you are strength training or you have a really strong yoga practice, the point is to increase your strength or increase your flexibility and mobility. And how we do that over time is we break that tissue down, and our body does this beautiful natural thing where it comes in and it rebuilds on that tissue so it's stronger and more resilient to load, to force, to stretch. And that is naturally occurring. And that is the point of this massage, is to create more flexibility and mobility so that it is more resilient to stretch. The second thing to consider is that perineal massage, to have its full benefits, requires consistency for the best results. And later I will get into parameters. Now, this next part, I am going to talk about trauma. So if you want to mute me at this part, please do so. And then once I'm done talking about it, I'm going to give a thumbs up if you want to unmute me. So another thing to consider is that this tissue right at the base of our vagina is actually pretty vulnerable. And so if someone who has experienced sexual, physical, emotional trauma, this tissue, this massage may elicit sensations or emotions that we didn't know were there. And so I think that this is actually extremely important to talk about, and as far as trauma during birthing experiences. So let's say if you were to start the perineal massage and you were working that tissue and all of a sudden you go, oh, I'm having these flashbacks or these triggers. I want you to lean into those emotions, and I hope you know that there are people in this community that can support you. But I think that the perineal massage is a great bridge, because once you are in the childbirthing place, there's going to be people that you do not know that are in your space. And that can be really uncomfortable in itself. But if you have already been touching that area and you already know that you're having this response or these emotions, we can seek help before we get to that point and start to work through it and desensitize that tissue to potentially not have that response during childbirth. So overall, perineal massage definitely has its structural benefits for creating that elasticity, mobility to the tissue, but it's an also very empowering tool for the birthing person as well. Okay, now we're going to get in the massage itself. So before we even get started, what I like to introduce are warming up principles, techniques before we just go internal and start stretching that tissue. So what you can do at home is you can get a heated compress and you can place that on your vulvar tissue. So I'm going to use this vaginal prosthesis, and if you have that warm rag, and you can just place it over there, and that's going to help bring in blood flow and warm up that tissue and start to loosen it on its own. So you can do that for about 5 minutes before you start the massage. The other thing that you can do is you can blow up those big birth balls, and if you haven't already, I highly recommend blowing that up, and we can start some birth ball exercises. So if you were sitting on that ball, so I'm going to use this pelvis, what I want you to think about is that our legs are out wide, and what that's going to do is going to open up the top of the pelvis, and we're just going to rock back and forth just like this. So I kind of think about, I'm extending my tailbone, think about stick my butt out like a Kardashian, and then I tuck my tailbone in, kind of like I'm sitting like a grandpa butt. So I just rock between those two. So I'm inhaling, opening up, exhaling in. And it's really great to connect with your breath during this time. So I'm going to show you what it looks like on this model. So we're just inhaling, we're opening up the back of the pelvic floor, extending tailbone, and then exhale. And what you can do on the birth ball is now go in these counterclockwise motions and then into the other direction. And so what that ball is going to do is it's going to give our pelvic floor some feedback to help descend and help lengthen the pelvic floor. So we're just going to go back and forth and into the other direction. And then we can just do some side to sides. And that will be really nice just to start warming up the pelvic floor and the muscles. If you don't have the birth wall, you can do some mat stretches. So I like to think about a cat-cow. So we're just inhaling, our chest comes out, our back arches in that cow pose, and then we exhale, we tuck and we round. And this is influencing our pelvic floor just like we were on the ball. We're opening it up and we're closing it. We're starting to move through full range of motion. You can go back into a child's pose, breathing deep into the pelvic floor to open it up. You can go side to side. And then you can do some windshield wipers with your knees. So I'm going to demonstrate just moving the legs back and forth. And so the moments that we're looking for are hip internal rotation because our pelvic floor muscles attach to the pelvic bones right here. And whenever we internally rotate our legs, bringing our knees in and our ankles out wide, it's starting to stretch the pelvic floor just like this. Okay, so once you've done the stretches, the heated compress, then we can get into perineal massage. So first things first, because like I said, we are creating micro tears into the tissue, and that is the point, is to regain resilience into the tissue. We definitely want to wash our hands the 30 seconds to a minute. And I want you to set yourself up in a comfortable position. Now, there's a couple of positions that you can be in. So the position that I recommend first is laying on your back. There's pillows behind you, and your legs are up and supported, and your legs are out wide. You can be in a side lying position. You can be in an all fours position. You can be in a standing position, and I will talk about that later. But I am going to teach the perineal massage in 3 different ways. So I'm going to teach it as if you were doing it. I'm going to teach it if you needed a tool, and I'm going to teach it if your partner wants to perform the perineal massage for you. So you are laid back, and we have our vulva right here. Now, it depends on where you're at in your pregnancy. You may be able to reach over your abdomen, or you may be at that point in your pregnancy where you can either reach underneath your leg to get your vulva. So I'm going to show you what that looks like. So if my leg is propped up, my vulva is here, I just link my arm in and I'm right here on my vulva. Now, again, your abdomen may be in the way, so you may not be able to flex your foot up as high, and then you may need a tool or your partner. So if at this point you can reach your pelvic floor, we're going to wash our hands and we're going to get a water-based lubricant. I personally like Slippery Stuff or Good Clean Love or Uber Lube. You can use vitamin E oil. I personally don't recommend coconut oil because the particles of coconut oil are bigger than our pores. And I just want to prevent clogging of any pores in the vulvar tissue. So, okay, so we have our clean hands. You can glove up if you want. And then we're going to start. So we have 3 different techniques when doing the perineal massage. But before we get started, we're going to orient ourselves to the clock because I'm going to use these numbers. So we have 12 o'clock. Now this is my left side and this is my right side. So 12 o'clock, 1 o'clock, 2 o'clock, 3 o'clock, 4 o'clock, 5 o'clock, 6 o'clock is the perineal body. 7, 8, 9, sit bone, 10, and 11, and back to 12 o'clock. The perineal massage is going from 3 to 9 o'clock. So you are going to go in, we're going to go either pad down or your fingernail down, and we're going to push down into the tissue, down towards your tailbone, down towards the ground, or down towards your feet. So down to stretch the tissue and out because this is all empty space up here. So we want to get down. So the first technique are holds, and we are going to hold that tissue down for 1 minute. And during this time, you can do some breathing, so inhaling and exhaling, trying to relax that pelvic floor and just starting to tune in to what you're feeling and those sensations. When you first start it, you may feel some burning sensations similar as if you were doing sustained wall squats. You may feel a burn, and that's definitely okay. So we're going to go hold 6, hold 5, hold 4, and hold 3. And then we're going to do the other side. Hold 7, hold 8, hold 9, all 1 minute. Now the next technique are sweeps. And so what you're going to be doing is sweeping from 3 o'clock to 9 o'clock. And we're just staying about 1.5 inches in your first digit. And we're just sweeping back and forth. Now you can go as slow or as fast as you would like, or as you feel comfortable. We're just again sweeping 3 to 9 o'clock. We're doing that for about 2 minutes. Now the next technique is a hold. And so I like to hold in pulls. We're going to do pulls next. So you are going to go in onto the tissue and a little bit into those muscles around 5 o'clock, and we're going to start to pull out. And we're going to hold. And once you've held, then we're just going to move up and pull again. And we're going to do that on the same side. Pull and pull. And so again, you might notice when you first start doing this, it may be uncomfortable. And that's okay. I want you to stay between that 1 and 4 range. Anything past, let's back off. Let's reset the pelvic floor. But I think it's really cool is if you start to feel that discomfort, naturally what happens is we're going to tense our body. And that could happen during childbirth is that we start to feel that pull and we start to tense up. And we don't want to tense up because that is how tearing can occur. So if we want to learn how to relax the pelvic floor during that, during those times when it's uncomfortable. Now, that is if you were doing it with your own finger. Now, there are 2 tools that I would like to show. We have this pelvic wand, and it's by Intimate Rose. Now, this wand itself, it's purple. It doesn't have a vibrating function. There's no cooling or heating functions, but Intimate Rose does make a pelvic wand that does have a vibration and heating and cooling wand. So, if you were to use this at home, this is the side that we are going to use for the perineal massage. And so we can hold this wand 2 different ways. We can go in and pull down, or you can flip the wand depending on your dexterity, and we can go down. Now with the wand, what may happen is it may point up. And when it points up, we may be on the urethra or we may be on the bladder. And that could be uncomfortable and it could elicit sensations like that you have to pee. And so we just want to avoid up in that area. So again, I'm going to point it this way. So if I were down, this is what the wand would look like. And so I'm pulling down, 6 o'clock, hold, 5 o'clock, hold, 4 o'clock, 3 o'clock, hold, and we would do that on the other side as well. And again, I'm not going too far deep. And then we would do the same thing. We would sweep from 3 to 9 o'clock, 2 minutes. And then we end with the pulls. And so you're going in and we're starting to pull that tissue out. We want to breathe in. We're doing that for 2 minutes. And that's with the pelvic wand. Now we have another device, and that is called the kiwi. The kiwi is specific for this. It is specific for the perineum. Now it's a really soft texture. It has multiple uses. You can actually use it just on the labia. I kind of think about it like a Theragun, right? If you were to put it on your muscle to help relax it, The Kiwi does the same thing. And there's about 10 different speeds, so you would just find whatever works best for you. So again, you can go in this way, or we can flip it if you need a little bit more dexterity and a little bit more force to push it down like this. So when I teach it in the clinic, it's about 50-50 if people use it down this way or down this way. So you'll just have to figure out which one works best for you. And we're going to do the same thing. Holds, 6, 5, 4, and 3. Hold, 7, 8, and 9. We sweep, and sweeping with the vibration is super beneficial because we're also going to bring in more blood flow with the vibration. We're sweeping and then we're holding. And so why I also like the Kiwi too, unlike the pelvic wand is long and we can kind of get lost in the vaginal canal. But with the Kiwi, we have a firm stop, so we know we're not going anywhere deep. And so I like this, and you can also bring this to the hospital as well. And this is a really great tool to also help open up the pelvic floor during childbirth. Now, if it is your partner, so let's say you're not going to do a tool, you no longer can reach, you're going to have your partner do the perineal massage. And this offers already some added benefits as well. So some added benefits is that it's someone else on that tissue, exactly like it's going to be during childbirth, most likely. And you will also have to communicate and advocate if that pressure is too much, or if they need to slow down, etc. And you also get to use your breathing techniques and truly just focus on your body at that time. So this part is for the partner. So I'm going to use a different model. Same concept though. So we're going to go, so at first, what they're going to do when you're first introducing it with your partner, they're going to use one finger and they're going to go pad down. So they're going to have lubrication on with a gloved finger or a washed hand, and they're going to go in just at their fingertip and press down at 6 o'clock, down at 5, down at 4, down at 3. And we're doing the same thing on the other side. They're going to do the sweeps 3 to 9 o'clock for about 2 minutes, and then they're going to end with pulls. So same concept. They're just in that 1 inch and they're starting to pull the tissue, and this is where you can breathe through it. Now, here are the added benefits. As you are progressing in your pregnancy, your tissue is going to become more plump and it's going to have more flexibility and mobility than it did previous weeks. So what your partner can do to progress you is go in 2 fingers. So what they're going to do is they're going to overlap their index and middle finger, and they're going to go in. And once they're in, they're going to flatten it out and they're going to do the same thing, but now with 2 fingers. Now, once you feel comfortable with that, they can then progress to 2 overlap and 2 overlap. So then that way they go in, flatten, go in, flatten. Now they're giving bilateral. Both sides are stretching down. So this is going to be a little bit more intense, but if your tissue can handle it, then I would highly recommend it. Another technique that they can do is their thumbs. If you can't tolerate this split, 2 fingers, they can go in both thumbs. So going in and then stretching that tissue, and they can just go into those semi-lunar shapes. So as far as the research goes, typically perineal massage starts at 34 weeks, 3 to 4 times a week, 5 to 10 minutes. However, like I said earlier, if I give you more time to prepare for an intense stretch, the better the outcomes. So at Tonic and Phasic, we start our patients or our clients at 30 weeks. And what I start is 30 weeks, 3 to 4 times a week, 10 to 15 minutes. And then once they hit that 34 weeks, they can give me feedback on how it went. Are they struggling with it? Do they need a different device? How's their breathing going? So it gives us time to start to prepare for that 34 mark. So now once we're at 34 weeks, now we start it every single day and we're doing it 10 to 15 minutes, all the way up until you give birth. And you can do this on the day that you give birth. Now, this is the part that is really cool and that I preference. So earlier I was talking about positions that you can do the perineal massage in. Now we can do lying on our back, but you can also do side lying on all fours or standing up. And so what I like to do is introduce this with people at the clinic. So let's say they are choosing for an epidural. And maybe they give birth on their back, but maybe they give birth on their side. And so we want to practice stretching your tissue in those positions. So if you are choosing to have an epidural, stretch your perineum laying down on your back and even having a roll underneath your pelvis, because we need your sacrum to open up and extend to allow for that. Let me show it in this way. We want the sacrum and the tailbone to open up so that the perineum can open up. And that's also how we reduce the risk of tearing. So again, if you're laying on your back, we can just stuff some sheets or some towels to reopen the sacrum and tailbone to open. If you are in a side lying position, which I highly recommend, our sacrum and our tailbone are going to open, and you have less risk of tearing in a side lying position. So if that's sounding like something that you want to try, definitely stretch in this side lying position. And you would just go internal and you would do the same thing, just pulling up, and you can come out and switch and do the same thing. Now, if you're choosing not to do an epidural, you can be on all fours and coming behind, or you can have your partner help you. You can also do this in standing, like if you're in the shower, you have one leg propped up, and if you're able to get internal, or again, use your tool, and we would do the same thing because we want to prep the tissue for whatever position you are going to push in. Okay. Now, let's talk about what if you do tear and what healing looks like. So, depending on the tear, healing is different. But if it's a stage 1 and a stage 2 tear, or sorry, a first degree or a second degree tear, the tearing has a pretty linear projection, and those first 2 weeks may be really uncomfortable, but then you should start to heal. The stitches should dissolve. There should not be any pain after 6 weeks. If there is, definitely let your OB, your midwife, or see a pelvic floor PT because that is not normal to have perineal pain after 6 weeks. And so what you want to have on hand is a peri bottle to help flush that tissue so we're avoiding contact. I think it's really important to talk about bowel and bladder mechanics in those first 2 weeks. So definitely getting a squatty potty. Same thing that you gave birth in, whether your legs were out or your legs were in, whatever feels best for your pelvic floor, and grabbing a couch pillow, keep it in the bathroom. And whenever you are pushing, we want to push that pillow onto our abdomen to help eliminate, and that can also protect the perineum. Now, if it is a larger tear, a third degree or fourth degree tear, that will need stitches and will need observation following with your OB. In a fourth degree tear, if that does happen, definitely let it go through that full healing process, probably about 8 to 12 weeks, surgical repair, and then definitely see a pelvic floor PT because a third and fourth degree tear starts to influence our bowel, our bladder mechanics, sexual functions, support of our organs. Some contraindications that I want to talk about with a perineal massage. Please do not perform a perineal massage if you have an active infection. This could include yeast infections, UTIs, or herpes. or if you have a high-risk pregnancy and your OB or midwife has decided that you are not to have internal touch. So this is where a perineal massage would be contraindicated. Okay, so that is it. But quickly, I want to talk about our birth prep program. So our birth prep program is 6 sessions, and our third session is all about the pelvic floor and the perineum. So we are doing a lot of hands-on with the given content that we just went over. But our first session is our birth flow session. And so what that looks like is we're creating your birth guide, your birth flow, a birth plan, so that way we can see what you're wanting, even what your concerns are, fears are. So we're kind of putting that out there to create a plan that best fits for you. And during this time, we're looking at your body structurally as well. So we're looking at your hips, your abdomen, your breathing mechanics, and we're just getting this foundation of where you're sitting and how we can optimize any restrictions or strengths or mobility to favor you during childbirth and into postpartum. Our second session is opening and releasing session, and that is all manual therapy, a lot of handwork where we're opening up the abdomen, this back tissue into your glutes, your pelvic floor, your inner thighs. So that's a really nice session as well. And we end with a nice stretching flow that you can take and every single day, because this flow is dependent on your body and what you need from what we found in the previous session. And that third is the pelvic floor session, everything that we just covered, and more manual therapy. The fourth session is labor and pushing techniques. So this is a really cool session as well, because we're essentially putting you in positions that you want to labor in, that you want to push in, and we're testing your breath work. We're testing the power that you can give. And so let's say people are like, I want to push on all fours. We say, amazing, great. Let's put you on all fours. Let's test your pushing mechanics. Let's give you some feedback. And so that way you can start. I always think about birth like a marathon, probably like an ultra marathon, right? We just don't want to go into it day one and not have those tools. And you may use all the tools that we go over, you may use none of them, but at least you have them. And that is our goal, is to walk you through on how your body's already performing at this pregnancy baseline. Then our fifth session is our partner session. And this is one of my favorite sessions because we get to bring in your support team, whether this is a partner, a mom, a friend, and we get to coach them through what we've been doing in pelvic floor PT. What are your strengths? What are things that we should consider? How to best advocate for you in the hospital room. And we're just teaching them a lot of hands-on things that make you feel good. And it also gives them confidence at home, and it gives them a role to play in this birth. And that's also very empowering to the partner or to the supporting individual. And then our last session is a full review. So of everything we did in the previous 5 sessions, and then we get into postpartum. What are the first 4 weeks of postpartum looking like as far as physically, mentally, and emotionally? So we walk through all concerns. We go through transitional movement. So once you've delivered the baby and you have this big open space in your abdomen, how do you get in and out of bed? How do you carry your baby without injuring yourself? How do you put your baby down? What about the first poop? What about the first pee? What are things that we should be thinking of? And that's just a little snapshot of what we're doing. So thank you so much for attending this webinar series. I am very appreciative, and thank you for having me. And I am going to end the recording right now.